want you to imagine something for a moment that feels almost impossible to accept because it sounds so peaceful on the surface, and yet it hides something deeply unsettling underneath. A man went to bed like any other night, no signs of distress, no loud warning, no struggle, and by morning he was gone, taken quietly in his sleep by something he had been doing for years without ever questioning it. I am speaking to you today not to frighten you, but because I have seen this happen more than once, and each time it leaves behind families asking the same question in a trembling voice: how could something so ordinary lead to something so final? If you are listening to me now, or if you are thinking about someone older in your life, a parent, a spouse, a neighbor, I want you to stay with me until the end, because this is one of those quiet dangers that does not announce itself loudly, yet it can change everything overnight. If you find this meaningful, I invite you to share your thoughts in the comments, because your experience may help someone else. And if you feel this message matters, a simple like can help it reach more people who need to hear it, especially those who believe that what they do before sleep is harmless simply because they have done it for so long. What I'm about to talk about is not rare, and it is not complicated, which is exactly why it is often ignored. It is the habit of going to sleep under the influence of certain substances or conditions that quietly interfere with the body's most basic life-sustaining systems during the night. It may be alcohol taken to help with sleep, or sleeping pills used without careful supervision, or even the combination of medications that slow breathing more than the person realizes. Sometimes it is untreated sleep apnea, sometimes it is lying flat immediately after a heavy meal, sometimes it is ignoring persistent nighttime discomfort because it seems easier than dealing with it. Let me tell you about a patient I once knew. He was in his early 70s, a gentle man who had spent his life working hard and caring for his family. He had a simple routine every evening. After dinner, he would sit quietly, sometimes watch television, and then take a small drink to help himself relax. He believed it helped him sleep more deeply. Over time, that small drink became a slightly larger one, not excessive in his eyes, just enough to feel calm. He also took medication for blood pressure and occasionally something to help with anxiety. He never thought of these things as dangerous because each one, on its own, seemed manageable. His family did not think much of it either, because he looked fine during the day. He walked slowly but steadily, he spoke clearly, and he did not complain much. The only thing he mentioned occasionally was that he sometimes woke up feeling tired, but he assumed that was just part of aging. One morning his wife tried to wake him, and he did not respond. There was no sign of struggle, no indication that anything dramatic had occurred. It was quiet, almost too quiet, and that is often how these cases present themselves. When we later looked more closely at his situation, the pieces began to form a picture that is all too familiar. The combination of alcohol and sedative effects from his medications had gradually reduced the responsiveness of his brain during sleep. His breathing, which already became shallower at night due to age-related changes, was further suppressed. If he had episodes of sleep apnea, which we strongly suspected, they would have been worsened. Each pause in breathing would last a little longer, each drop in oxygen a little deeper, until eventually his body did not recover from one of those episodes. This is something many people do not realize. Sleep is not simply a time when the body shuts off. It is a delicate, active process where breathing, heart rhythm, and brain activity must remain balanced. In younger individuals, the body has a strong ability to correct imbalances. If breathing slows, the brain quickly responds. If oxygen drops, the body reacts. But as we age, these corrective systems become less robust. Now imagine adding something that suppresses those responses. Alcohol is one of the most common examples. It may make a person feel sleepy, but it disrupts the natural sleep cycle and relaxes the muscles in the throat, increasing the risk of airway obstruction. Sleeping pills, especially when not carefully monitored, can further reduce the brain's ability to respond to low oxygen levels. Certain pain medications can slow breathing. When these factors combine, even if each one seems mild, the overall effect can be significant. I remember another case, a woman in her late 60s who lived alone. She had trouble sleeping for years and had been prescribed medication. Over time, she adjusted the dose on her own because she felt the original amount was no longer effective. She did not inform her doctor, not because she wanted to hide it, but because she thought it was a small, harmless change. She also had mild obesity and occasional snoring, but no formal diagnosis of sleep apnea. One night she took her usual medication, slightly higher than prescribed, and went to bed. She was found the next day, again without signs of distress. The conclusion was similar. Her breathing had likely slowed beyond what her body could compensate for, especially during deeper stages of sleep. What makes this particularly difficult is that it does not feel dangerous in the moment. There is no immediate pain, no clear warning. It feels like rest, like comfort, like something that helps. That is why I often say that the most dangerous habits are not always the loudest ones. They are the ones that quietly become part of daily life. There is also the issue of heavy meals before bed, which many people dismiss. Eating a large meal late at night can increase the risk of acid reflux, which may not always wake a person fully, but can trigger subtle airway reactions. In some individuals, especially those with underlying heart conditions, this can contribute to disturbances in heart rhythm during sleep. Combine that with lying flat and reduced breathing efficiency, and you begin to see how multiple small factors can align. Let me explain something important in simple terms. During sleep, especially deep sleep, your breathing naturally becomes slower and more regular. Your heart rate decreases, your muscles relax. This is normal and healthy. But if something interferes with this balance, such as an airway obstruction or suppressed brain response, your oxygen levels can drop. In a healthy system, the brain senses this and briefly wakes you up just enough to restore normal breathing. You may not even remember it. However, if the brain's response is weakened or if the obstruction is too severe, that recovery may not happen effectively. This is where conditions like sleep apnea become dangerous, particularly when untreated. And when combined with substances that depress the nervous system, the risk increases significantly. The part that many people do not expect, and this is where I want you to listen very carefully, is that these events can occur in individuals who seem relatively stable during the day. They may not appear critically ill. They may not feel that anything is wrong beyond minor discomfort or fatigue. This creates a false sense of security. I have sat with families who told me, "He was fine last night," or "She just went to sleep like always." That word "always" is often where the problem lies. When something becomes routine, we stop questioning it. There is another layer to this, which is the role of underlying heart conditions. As people age, the heart becomes more sensitive to changes in oxygen levels and stress. Nighttime drops in oxygen can trigger irregular heart rhythms. In some cases, these arrhythmias can become life-threatening if not corrected quickly. During sleep, especially if the brain's alert system is dampened, the body may not respond in time. I want to share a final story that stayed with me. A retired teacher, respected and loved, who had mild heart disease but managed it well. He also had a habit of taking over-the-counter sleep aids along with a small amount of alcohol. He believed it helped him rest more deeply. His family had gently suggested he mention it to his doctor, but he brushed it off. One evening, everything was as usual. The next morning, he did not wake. When we reviewed his history, the pattern was clear. The combination of substances likely suppressed his breathing and contributed to a cardiac event during sleep. This is the moment where many people feel a quiet shift inside them because they begin to recognize something familiar in these stories. It is not about one extreme action. It is about small, repeated choices that seem harmless but can accumulate into something serious. If there is one thing I want you to carry with you from this, it is this simple but important truth. Sleep is not a passive state where anything goes. It is a vulnerable time when your body depends on balance and responsiveness. Anything that interferes with breathing, heart rhythm, or brain alertness during this time deserves attention. This does not mean you should live in fear or avoid sleep. It means you should respect it. If you or someone you love relies on alcohol to fall asleep, it is worth reconsidering. If sleeping pills are being used regularly, they should be reviewed by a doctor. If there is loud snoring, choking sounds during sleep, or persistent daytime fatigue, these are not small issues to ignore. They are signals. Even simple changes can make a difference. Eating lighter meals in the evening, allowing time before lying down, discussing medications openly with a healthcare provider, and being aware of how different substances interact with each other. These are not complicated steps, but they require attention. I understand that habits are not easy to change, especially ones that feel comforting. Many elderly individuals value routine because it brings a sense of stability, but sometimes the most caring thing we can do for ourselves or for those we love is to gently question those routines. As we come to the end of this conversation, I want to leave you with a sense of calm rather than fear. Awareness is powerful. Many of these risks can be reduced significantly with small, thoughtful adjustments. The goal is not to remove comfort from life, but to ensure that comfort does not quietly become harm. If this message resonated with you, I invite you to share it with someone who might need to hear it. A simple conversation could make a meaningful difference. And if you found value in this, your support through liking and subscribing helps bring these important discussions to more people who may not even realize they need them. Take care of your nights, because they are just as important as your days. And sometimes the quietest moments are the ones that deserve the most attention.